Hello everyone. Today we'll be talking about Polycystic Ovarian Syndrome, commonly called as PCOD or PCOS. As you all most of you must be familiar of this terminology because you might be hearing from your friends, your neighbors, or you might be the one who might be undergoing with this condition of PCOD. So we'll just have a talk on it. So what exactly PCOD is about? So how can you identify PCOD at a very early stage? So normally PCOD presents as irregular cycles. That is the most common symptom with which a female can present having polycystic ovaries. So normal cycle length is somewhere between around 28 to 30 days. But in PCOD, the cycles are much more delayed. It can happen after 45 to 60 days, or sometimes it cannot happen, and it usually happens only if you take a withdrawal pill. So this is the most common symptom of PCOD. The other most common symptoms are like they might have excess hair growth, the facial hair. There is a lot of facial hair on the upper lips, chin, and more excess hair growth on the chest. And there is frontal baldness, that is, there is loss of hair in the frontal region. So this is other symptom of polycystic ovarian syndrome. And most of the females might be obese because of insulin resistance. So patients with polycystic ovarian syndrome, they are resistant to the insulin, that is, their glucose metabolism is altered, their sugar levels are elevated. This is indirectly evident by their skin, which shows darkening around their necks and underarms. So any darkening of the skin around the neck or underarms usually suggests that there is an insulin resistance in the body, which is commonly seen in patients with polycystic ovarian syndrome. So these are the few things by which you can identify that you are having an underlying PCOD or PCOS. So one thing is the menstrual irregularities, the second is excess hair growth and acne also. This is mainly because of the male hormone called testosterone, which is more in patients having polycystic ovarian disease, and an insulin resistance which is seen by darkening of the neck and darkening of the underarm. So these are the few things which you have to remember. So when you have these conditions, you have to meet your gynecologist to get diagnosed whether you are exactly having the same thing or there is some other issue for all these symptoms. So we'll come to know what you have to do in your lifestyle to prevent getting polycystic ovaries. Suppose you have all these symptoms, the main thing which you have to do is change your lifestyle. It mainly focus on your diet and exercise pattern. In diet, cut down your carbohydrates, have high protein diet and a balanced diet. And coming to the exercise, you should at least do a moderate kind of activity for at least 150 minutes a week, which might include a brisk walking, swimming or cycling. So this amount of exercise will prevent you from developing polycystic ovaries. And those who are already having polycystic ovaries, your menstrual cycles tend to become regular, your insulin resistance decrease, so that your future risk of developing hypertension, diabetes and heart diseases is also cut down if you change your lifestyle. Coming to the reproductive part of polycystic ovaries, so what exactly it can happen, as we discussed, one is the menstrual irregularities. The other issue which you can face with polycystic ovarian syndrome is your ability to conceive. Because in polycystic ovaries, the main problem lies with ovulation. The ovaries, because there is increase in testosterone hormone, ovulation is prevented and you might face difficulty while conceiving. So you have to just diagnose yourself as early as possible. If you have irregular cycles and all these symptoms, meet your gynecologist if it is for irregularities, or fertility specialist if you are having a concern in conceiving. Thank you.